This conference will now be recorded.
So again, thank you everyone for coming out, and welcome to the first session of our Racial Equity Dialogue series, hosted by the North Carolina Balanced Estate, COC, Racial Equity Subcommittee. We are here today to talk about, COVID-19 in the Black community. And as we approach this work with the understanding that racism and racial disparities exist, we're embedded in the institutional level and focusing our attention on these marginalized communities and, really looking at and focusing on these effective ways to, organize equity. And so this panel discussion with our facilitators today will guide you guys through the discussion. And we definitely expect you all to use respectful language. Myself and other staff members are monitoring the chat, and if we see any degrading language, you will be removed instantly. And that is just to mainly protect the space and the safety of this space. And so we definitely, have a great conversation lined up for you all today. And as with our racial equity subcommittee meetings, we encourage you to have your cameras on. Definitely makes us feel like we're a little more present with each other. It's not, as early in the morning as 9 or 10. So we definitely would like for you guys to turn your cameras on. And I would also like to say that this event is definitely nonpartisan. As one of our candidates is running for office in the city of Henderson, I will simply say that while we're grateful for her participation today, we do not endorse any candidates for political office. And so, with that being said, once again, I just want to thank everybody for being here and thanking you all for the opportunity to listen to your colleagues grow with us as we work to pretty much dismantle structural white supremacy and systematic racism here in the North Carolina Balanced Estate, COC. And with that, I know it's kind of long-winded there. I will turn it over to our awesome facilitator today, Ms. Tambra Chamberlain, who is a McKinney-Vento liaison for the Moore County Schools. And I'm going to pass it off to you, Ms. Chamberlain.
Thank you. Thank you so much, Jeremy. Welcome, everyone, and thank you for joining us for the first dialogue series of 2021. A special thank you to the Racial Equity Subcommittee for hosting today's discussion. We are grateful for our facilitator and panelists offering their time today to talk about a very difficult subject. As you know, we've been experiencing a pandemic over the last 18 months. Black and brown people and communities have been hit very hard. We continue to see amongst the homeless, and the pandemic has made it even more difficult for marginalized communities to access health care, housing, and services. We're here today to talk about racial disparities and how institutional racism has impacted a pandemic, because we believe that everyone deserves a safe, sustainable, and affordable home in the pandemic and beyond. Again, as Jeremy had pointed out during the discussion, all offensive and inappropriate language is prohibited. We want a safe space for all to be able to share your thoughts respectfully and share your ideals. Our first question is for Wanda. What is the community's impact in either opposing or supporting people of color who experience homelessness? Wanda, you are muted. Sorry about that.
Thank you. Just to have a conversation here with myself. What is the community's impact in thwarting or supporting homelessness? And I guess it pretty much depends on what community you're in. I will first start with the state of North Carolina. And I would say, here in the state of North Carolina, there's a lot of work that needs to be done as far as the community, as far as homelessness. It goes back to the historical issues that have caused homelessness here in the state of North Carolina, such as poverty, segregation, housing discrimination, housing injustices, mass incarceration, access to quality health care. All of those disparities have marginalized Black and Brown people. And from those issues, it has caused people to be homeless and houseless. And so I would say, as the state as a whole, there needs to be there's a lot of work that needs to be done. A lot more funding needs to be funneled into these communities, rural communities, and also these more urban communities like Raleigh, where I'm from, Charlotte and such, but also some of these small rural areas, as I mentioned. In order for communities such as, say, more Richmond County, actually, I'm from Richmond County, for some of the things that the communities could need that funding, even though homelessness isn't as prevalent and seen as, like, if you come to some of the larger urban cities, it most definitely exists in those communities. And to help thwart those things, for one, I feel like what some of these smaller communities could do is awareness. Make sure that that it is talked about, that is not frowned upon, that it is addressed. It is addressed through the mental health systems. It is addressed through the human service systems. That it is recognized as an issue through the local government systems in those small rural towns. That it is something they must address, and it is something they talk about and not stigmatize people for. And so once that it is addressed, and it's an awareness, that people may be more willing to create their own nonprofits or own programs to address it from either on the church standpoint, and in these rural areas to help those who are facing homelessness and houselessness. I feel like, a lot of times we look for, the government or others for help. That's true. They do have their place for helping, but I also believe that those who are close and mostly impacted in the community have the answers. They know what they need. So go to those in the community who are facing homelessness and houselessness in those rural areas, and address those issues, and create programs which may look different than some of these larger cities. So that's what I think is needed in the rural areas. So when we come to these larger areas, I think, again, some of those same issues, but on a much larger scale, such as redlining, mass incarceration and gentrification has caused homelessness and houselessness in these larger cities such as Raleigh and Durham and Charlotte and such. So from there, there's a lot of awareness in our areas about homelessness and houselessness. But I feel like the outreach in those areas are based on numbers and not people. They'll look at the data and say, hey, this is the number of people who are homeless. But what, instead of who those people are, what about Wanda? What about Teresa? What about Ann? What about Marcia? Instead of the number, what is Wanda going through? What is Ann going through? What is Marcia going through? You know, understand me as an individual, my story. Listen to my story. What I'm going through may be different than Teresa. So instead of looking at the data, the funding I may need maybe for storage. I'm houseless, but I may need storage to put my items up until I'm ready to find another place. Teresa may need funding for first month's rent. But I think they look at us as a whole in some of these areas and say, hey, here's first month rent. Here's first month rent for everybody. And that's how they're going to create the program and create a program for first month rent for everyone. But actually what I need is money for storage before I can even look at first month's rent. So what I'm saying is basically, I feel like in some of these urban areas and larger areas, is that the programs are created on numbers, but not actually on the needs of people as individuals, as human beings, and that is partly because they don't meet the people where they are. They'll write down, they'll get the statistics, and they think that speaks for the community instead of meeting the person where they are and addressing those people's individual needs. So I don't think they do enough to thwart homelessness and houselessness for African Americans whom faced homelessness more than any other ethnicity here in the state of North Carolina. So, you're on mute now, Tambra.
I'm on mute now. There we go. Let me turn up my volume again. Yes, thank you. And personalizing that data is very important. Does any other panelists want to weigh in on this subject? Okay, for now we'll go to the second question. Is for Teresa. Everyone's unmuted? Yes. Okay. Teresa, what do we see from a health and wellness standpoint about the impact of COVID-19 for people who experience homelessness? For people who...
All right, can everyone hear me? I want to make sure I'm not muted. Okay. So I will start off with just the buzzwords that we all heard throughout the pandemic and even still now. When we're talking about health and wellness, I think these buzzwords that we all know all too well, like shelter in place, avoid non-essential travel outside the home, and social distance. Those are things that we've heard over the past 2 years that when you frame it in the reference of homelessness, what does that look like for someone that's experiencing homelessness? If you're in a shelter, they lowered the shelter capacity, so people were put in hotels or were left to go out on the streets. Also, non-essential travel is not really an option for someone that might be transient or without a home. Like Ms. Coker said, I like houselessness and homelessness, and also social distancing. That's not really an option for people that live in communal living. You can't get but so far from someone. So I want to think about those words as I go forward, talking about health and wellness and the impacts of people that are experiencing homelessness. I always go back to the social determinants of health when we talk about COVID-19 and especially homelessness. And I'll start with economic stability. So I'm probably speaking to the choir here, but a lot of homeless people do have income. Believe it or not, a lot of people experiencing homelessness do have income, but these people are also likely to be in service industry work, and they don't have options for working at home like many of us do. And a lot of people lost wages, and they just didn't have the same flexibility as other people when it came to working. Also, of course, your socioeconomic status and your employment directly correlate with your health. So when you're not working, you're more stressed out. Your meals might not be as consistent. Just everything is kind of thrown off. When you also think about Maslow's hierarchy of needs, when you are without a home, it's like what needs come first. And so you have to make very difficult decisions when it comes to your needs when you're experiencing homelessness. Also, the second determinant of health that I wanted to discuss is neighborhood and physical environment. When the pandemic started, public areas like libraries and fast food restaurants and other communal areas where people who are experiencing homelessness might travel to during the day when they're not in the shelter, those places closed. So people didn't have access to a lot of those resources like they used to. They also lost some access to facilities that provided sanitary options for people to just do basic hygiene activities. And unfortunately, the communities that suffer from this issue the most are areas where there's environmental injustice, structural racism, and other implications on poverty that have made not only it hard for people to maintain daily life, but it affected people when it came to the COVID-19 virus. Also, the physical environment, when we're thinking about the shelters, of course, shelters were extremely high-risk environments for not only the workers, but also the people that lived there. Because you can only, like I said before, you can only separate people so much. And then when you also add in a physical environment of someone that might be homeless, and then you take them and you put them in a hotel, and then they're dealing with social isolation, which is a whole nother wellness factor, because your mental health can suffer, let alone your actual physical health when it comes to COVID-19. When it comes to education, another social determinant of health, I always have to talk about this piece when I touch on education. I've been in this work almost 5 years, and every year I work, I meet more and more people with several degrees that are homeless. So the picture of homelessness is not, people that are uneducated and don't choose to work and just don't want to do better. It's lack of resources and connections and a safety net for people. But also when it comes to education, I want to talk about children as well. School changed completely. A lot of children who are in families that are experiencing homelessness, they did not have the same options when it came to eating at, like lunch was the meal that they would know they could have when they would go to school every day. That stopped. Of course, communities jumped in and rallied, and there were great options for kids to be able to get lunch while doing remote learning from home, but that was also a factor in their wellness also. And then under-resourced schools, of course, in communities of color, unfortunately, schools are under-resourced, and so that trickles down into less options being available for people that are already disproportionately affected by this pandemic. Also, food insecurity in reference to a social determinant of health. Pre-pandemic, I have a statistic here. Before the pandemic, there were 11.1% of households that were housing insecure in the United States. That's the standard level for people living in the U.S. Of that, households led by single parents, Black households were 21.85% housing insecure, and that number for Hispanic households was 18.7%. So when we're talking about food insecurity, I think I put this in the wrong place. That was supposed to be housing insecurity, not food insecurity. But those numbers still stand in reference to people that are housing insecure. 21.85% of Black households were housing insecure relative to 11.1% of the total population of the US being housing insecure. When it comes to food, access to resources. I know when the pandemic started ramping up, everyone got frantic calls from family members saying, hey, you need to go to the store and get this. You need to go to the store and get that. Stock up on this, stock up on that. We all saw the prices go crazy. We saw Amazon, people selling Windex, a bottle for $60. Like, we saw all of that happen. Like, imagine that happening for someone who's housing insecure or homeless. They don't have those options to swipe everything off the shelves. So they're literally dependent on someone else to provide that resource for them. I'm going to wrap it up quickly here. Community and social contexts in reference to social determinants of health. Like I said before, people who are experiencing homelessness don't have access to flexible resources. So their outcomes for everything is more risky. To give an example, children. Children are at a higher risk because they're dependent on parents. I just pulled an article that came out last week in reference to children that have lost caregivers due to COVID-19. This came from USA Today. Children of color have taken the brunt of being orphaned due to COVID-19. So 65% of the 140,000 children that were orphaned from the COVID-19 pandemic were children of color. And that's absolutely major. These children no longer have caregivers. And so you have to think about the effect that this has on every system that they're involved with. Do they have other resources where they can stay with family members? Do these family members have the capacity to care for the children, the schools, the healthcare system? Like, we're all in this huge system working together. And just in the context of how we're all affected, when you're already a community that's experiencing disparities, COVID-19 just made it that much worse for everyone. I don't want to end it on a low note, but that's really that's really covering everything I wanted to say about that piece.
Thank you, Teresa. And yes, some of the barriers that were caused by COVID-19, you can see it across many systems. And does anyone else, any other panelists want to weigh in on that subject?
And sorry to interrupt, but before they do, I definitely would like, because we got some awesome speakers here, and I definitely would like to take this opportunity to introduce them. If our three panelists could come off of mute and one by one introduce themselves, beginning with Miss Wanda.
Hello, everyone. Good morning, almost afternoon. I am Wanda Gilbert Coker. As I said before, I am originally from Richmond County, Moore County area, but I have been here in the Raleigh-Wake County area for 30 plus some odd years. So I feel like, this is actually home too now. But my background in the work of housing justice, really started from me being homeless and experiencing housing insecurity. And from that, I started having to do a lot of research and looking for resources for myself and realizing that, wait a minute, something is wrong with this system. It should not be this hard. What is the problem? And I had to fight for myself. And after fighting for myself and using my own voice, I realized, wait a minute, there are so many others who are also in my who are in my walking in my path or experiencing the same thing I have experienced. So thus I just started speaking out, joined various other organizations. Currently, I am part of the Wake County Housing Justice Coalition, the statewide Housing Justice Network. We just recently started the North Carolina Housing Justice for Black Lives, which is part of the NC Block organization, and I'm also a very active and committed board member of the City of Raleigh Fair Housing Board, and also Raleigh PAC. I'm also involved in various political campaigns, because I also feel like for us to make changes, we have to make sure we get the right people in office to make these changes for not only those myself who have experienced homeless, but also to make, well, be, as they say, be the change. In order, I feel like if you've gone through or can respect those who have gone through or want to do something about it, those are the people we need in office, not those who just want to run just because they want something on their mantle. So that's who I am, Wanda Gilbert Coker. Hello.
Thank you for that. Thank you.
And Melissa or Teresa?
Okay. Go ahead, Teresa. I'm sorry.
Okay. My name is Teresa Robinson. I currently am employed by Community Link. This agency is in Charlotte, North Carolina, and I've worked there it'll be 5 years next week. I actually, about 2 years ago now, I believe, I moved to the state of Virginia. So I work remotely from Virginia for a nonprofit agency in Charlotte, North Carolina. I currently serve as the coordinated entry lead for the Piedmont region. That covers Cabarrus, Davidson, Rowan, Stanley, and Union counties. I'm also a member of the Racial Equity Subcommittee, and I'm just an advocate for decreasing disparities in our communities. I have a history of just seeing disparities play out in life. My mom's a teacher. She's also a single parent, and I know what it's like to be housing insecure, and I just have a passion for working with people, and I'm happy to be with you all today to have this conversation, and I'm looking forward to lots of questions.
Good afternoon, everyone. I think I would just say I'm Wanda and Teresa put together. My name is Melissa Elliott. I wear many hats in my community. As Jeremy stated, I am not running for office. I'm in office. And I have been in office for over 7 years. I serve on the Henderson City Council as the councilwoman at large for Ward 3. I have a very vested interest in homelessness population because I at once was one of those people. And so I understand the stigma that's placed upon you. And it doesn't mean, just like Teresa said earlier, I'm big on the social determinants of health. So Teresa, thank you for that. But you don't have to be a person that's doing absolutely nothing to end up in a state where you don't have anywhere to live. It happened to me with my 2 kids years ago, and it was a very meaningful experience that made me want to advocate for people that don't have anywhere to go. On the flip side of that, I run a nonprofit organization called Gang Free Inc., and we are on the ground hard with vaccination equity and education and doing a lot of things with food insecurity. Been working ever since the pandemic started, and as you guys can see, I'm at the beach. I needed a much needed getaway, but this is my dedication because I'm still here with you all. So I hold a master's degree in public administration. I was formerly a middle school dropout. I was a teenage mom. So every disparity or every statistical data that could probably happen to an individual, even substance use, happened to me. And so on the flip side, I'm just an advocate for people, as Teresa said. I've seen these things play out. I've seen people write you off because they didn't feel like, oh, because you were homeless, that you didn't amount to anything, or because you didn't graduate, you didn't amount to anything. And here I am holding several degrees and all types of offices and all sitting on all types of boards. And I'm that voice in the room that says, wait a minute, let's think about this again. Let's talk about what Wanda said. When Wanda said, you know, they're not looking at me as an individual, they're looking at me as a number. And I think everybody's story is unique, but at the same time, I think the resources should extend. I also live in a rural community where we just got ARPA funds, and a lot of my colleagues don't know anything about being homeless, so that's not a fight for them. So I'm that voice in the room, right, that says, wait a minute, y'all. Now, we can't leave the families out. We have to serve the people. And I just want to encourage everybody on the line to talk to your elected officials, and don't get me for this, Jeremy, about the ARPA funding, because ARPA funding is designed to help the community, particularly citizens in the community. So I just wanted to drop that out there. But my name is Melissa Elliott, and it is an honor to be among all of these great minds. Thank you.
Thank you guys so much for introducing yourselves. And Melissa, the next question happens to be for you. Why is talking about vaccine hesitancy important to serving the African American community? And there's a second part. How would you address their concerns?
Well, I'm glad you asked. Well, you have to talk about vaccination equity in the African community. Hesitancy, I'm sorry. The reason why we have to talk about it is because of what history has done. I mean, we have factual data that states that we had a eugenics program in North Carolina that sterilized people without them knowing it. We have the Tuskegee experiment, you know, that put into the veins of 600 African American men syphilis for 40 years as they watched them. You know, it's the systems, the mistrust. We have to address vaccination hesitancy because people are not going to get vaccinated because of past experiences or past knowledge. And then on the flip side, it's misinformation. You know, I'm not going to cluck like a duck when I get a vaccination, or, you know, mass media put things out and social media, and you got celebrities endorsing things that are just not true. So it's the propaganda of what's being said. So we have to address it. And so how would I address it? I'm doing it. I promise you, me and my team are doing it. You have to listen to the concerns of people. Some of the people that are most at risk, the African American community that are 65 plus with these underlying health conditions, they lived through the Tuskegee experiment. You know, they were here when they had the eugenics program in North Carolina. I actually had a woman ask me, how do I know that this thing is not going to make her worse? Because she was one of those eugenic people. So you got to have an answer, right? And it's okay if you don't, but be informed when you're informing African Americans about becoming vaccinated. Have some statistical data. Tell them that you've been vaccinated. I think your story is the best story when you're trying to sell something to someone else. So I would address it by having information, you know, and not forcing people. Like, we can't make people get vaccinated, right? But we can encourage them to be vaccinated. And so what we do when we canvass and knock on doors, we always canvass and knock on doors, but you got to be present in your community. As it relates to the homeless population, you know, we take kits there for COVID testing, and then we talk to people. Like, people don't want you just to show up and say, get vaccinated, right? So we have to address the concerns and listen to what people feel and what they care about, and then come back with information, like valid information, credible information, things that, that have been studied, scholarly information, not just something that someone else said. So that has worked for us. We have coordinated over 40 vaccination clinics, and we make them user friendly. We go into communities and pockets that health systems just are not in, and so I think when people know that you care about them, it makes a difference in their response. If they don't take the vaccination right then, or they're still hesitant, leave them with the information, help them navigate the system of how you can actually become vaccinated. So there are several things that I do as an individual, that my team does, but you have to be present. People want to know who you are, and incentives, I promise you, always work. Unfortunately, some people come and get the incentive just because they can, but then there are some people that really could use those incentives. We went to the urban ministries last week, and we passed out 200 flyers. The urban ministries capacity for homelessness is 179 beds. We were there a week later when we promised the people. That's another thing. Tell the truth, fulfill your promises. We went there the next week, and we had 150 people standing in a line at the church across the street from urban ministries waiting to be vaccinated. They had been educated. We told them the truth. We told them, you may get sick from this first shot. Some people have adverse effects, some people don't, but we were very open and honest with them. And just to see the line there in the rain, if you all know, Saturday was a real rainy, dreary day. We had 150 people standing in the line waiting to be vaccinated because of our honesty. And everyone on my team has been vaccinated, because it's hard to sell something that you haven't done. So that's what I would say. Mistrust, misinformation, you're going to cluck like a chicken, eradicate all of that propaganda and move forward. If they don't get it, just give them the information, because people change their mind. We've changed our minds about things. So I would just say that's the way I would do it. Thank you.
Thank you, Melissa. That the mobilization of the community work that you're doing is needed. So those ideals are all great ideals. Thank you so much for all your hard work knocking on them doors. Our next two questions are for all the panelists. The panelists can weigh in. The first question is, at least 20 states don't include people living in homeless shelters in their vaccine distribution plans. How do states, and more specifically North Carolina, address this issue?
I can start by just speaking for what's happening in my region, in Region 5 in the state of North Carolina. I know that shelters actually reached out to local health centers or health agencies to bring a team to offer vaccines if people wanted to have them at their shelter. And so that's always been open in the counties that I work in. But there also, there are shelters in my counties that I work in that aren't interested in the vaccine. But I believe that everyone is making it available as an option for people to either go get one or have one at the location where they're at. When it comes to not having vaccine distribution plans, that's a problem. That's absolutely a problem, only because of everything that was just shared from the previous panelists. You have to give people education. You have to give people options to make their own decisions. They, like you said, they may not choose to have a vaccine that day. They may not choose to ever have a vaccine, but providing accurate and appropriate information, and it has to be information that's given in the right way, because sometimes someone could say something to you, and if they say it wrong, you'll never hear it. So it has to be appropriate to the community that they're talking to. You have to, like it's been said before, you have to meet people where they are when it comes to the vaccine. You have to hear their concerns about why they may not want to distribute the vaccine, and then address them one by one, and just continue to educate people, allow for open communication and pushing forward. Yeah.
Does any other panelists want to weigh in?
I can weigh in. Well, I've looked at different states and I don't really see a solid plan, Tambra, in any state. Because Teresa said it, some shelters want the vaccination clinics and some of them just don't. In Region 9, where I am the co-chair, I forgot about that. We're in Region 9, you know, we don't have a lot of shelters, number one. But we do have some in different counties, but in Vance County, we have two, well, three. We have the men's shelter that only opens seasonal. And so a lot of our homeless people, and particularly in the rural counties, are living outside, like literally outside. They are totally unsheltered, living outside. And so the plan that we've used is, again, taking the vaccination clinic to where they are. And as Teresa said, messaging, the message behind the vaccination is, it has to be user friendly, because if it's not, it's a total turn off, no matter what incentive you bring. So I've been looking at it. And when I got the questions last week, I deliberately went online to try to find some states that were doing some phenomenal things, but I really didn't find that. And that was very disheartening that I didn't find it. I do see where some states are mandating vaccinations in their shelters. I don't want to weigh in on that right now, but I do think testing is appropriate. So I think that North Carolina should be more boots on the ground with this effort, getting these people the information to help them make a decision, if anything else. And vaccination equity right now in education is huge. I know Healthier Together is pushing it. I'm a part of a grant cycle for PIH. They're pushing it. And I think that messaging makes the difference in any plan, because I'm not going to get vaccinated if I don't understand why. So that's my spiel. Thank you.
Weigh in? Good. Okay. For the last question, make sure I'm turned up a little bit more. What are the main challenges for Black and Brown people who come into contact with homelessness? And how do they navigate through this system? That's for all the panelists.
Okay, I'll go again. I think the main challenge for African American people as they come into contact with homelessness is that it's the system. The system hasn't been friendly. The systems and so many other systems, medical systems, government systems, mistrust, those just haven't been friendly. And so how they navigate through it, we help them navigate through it. All of us that's on this call have a vested interest in people that are homeless. I think that we are the conduit, if you will, to help them navigate these systems that won't make them feel like they're just a statistical number, or they're not important in our society. So I think that we help them navigate through it. And I thank God for Allie. Hey, Allie, because I was having challenges with HMIS, and I still am, but they have a list that helps us get people on the list so they can get help. So if I'm challenged with a master's degree messing with a system, then imagine a person that doesn't understand the system at all. So I think we are the conduits to help them navigate the system.
I'd like to mention, run off of Melissa, where HMIS is concerned, from my understanding, they're doing the pit count from the HMIS system. And some of the people in Region 4, we only have 3 shelters that have brought people in to do the vaccine, but we only have 3 shelters to go through 4 counties. And we currently do not have a men's shelter, so they either have to go to Statesville. I'm in Mount Airy. They either have to go to Statesville, which is over an hour away, or to Winston-Salem, which is basically another hour away. But Ann Simmons is in Mount Airy, and she is trying to create a men's shelter. So if anybody has any suggestions, please help her out. But as far as the pit count goes, they're going by the HMIS system. And a lot of people of color that when I went out and done the pit count, they are hesitant of giving all of their information to go into HMIS. And so we're not going to get an accurate pit count from the HMIS system.
Thanks so much for that, Joey. I do just want to remind everyone that the questions so far are just for panelists. For everyone who's attending, please, if you have questions for the panelists on the topic of racism, COVID-19, the eviction moratorium, or the vaccine hesitancy, the conversation that's happening, please do put that in the chat, and we can help prompt our panelists during the Q&A session in just a few minutes. We'll get there shortly, but thank you, Joey. Wanda, I believe you were next to come off mute. Thanks.
Yes, I think the challenges that African Americans face, I'm reading the question again, make sure I stay. The challenges that for Black people who come in contact with homelessness, and how they, what are the main challenges for us? Or one of the main challenges is the mental health system and the mental health conditions for African Americans, and going through homelessness and facing mental health issues is twofold. And it's a system of being homeless, and then going through a whole total different system of the mental health system. It can be quite traumatic, and then depending on what that trauma is from, it can be dealing from domestic violence, and youth violence from youth childhood, just so those type of things have a tendency, those twofold things have disparities, have a tendency to be very oppressive, and it takes just not just the homeless organizations working. They must also work with other organizations in social services and mental health social services, what they call human services, mental health therapists and such, to work with a person on various levels to get them through the system. So just helping a person who may be dealing with as Sister Melissa said, that may have experienced an issue with drugs, but is also homeless. Well, that person may also need to, putting them somewhere giving them somewhere to live is solving one of the issues, but the other issue is also maybe, get rehab or a therapist, and there are other things that go along with just housing a person. So I think those are some of the things that we, as challenges as African Americans, that the system needs to understand, that Teresa was saying as well, about the disparities that we face as African Americans, that just putting us in the house is not enough. There's also other traumas that go along with it that also need to be addressed. So.
And then this question is, Teresa, did you want to weigh in on the last question?
I can say something quickly. I think both of the previous panels kind of said most of what needs to be said, but I think the main challenge is definitely the stigma that comes along with homelessness. Black people who enter the homeless service systems likely have experienced poverty for most of, if not their entire life. And so when you think of packing that suitcase of poverty, what is all in that suitcase? What else have they experienced in their past that may have brought them to the place they're at now? Was it housing insecurity? Was it food insecurity? Was it evictions? Getting your car repossessed? Like domestic violence? It's just all these, and it doesn't even have to be all these negative things. It could have just been one bad event that happened and you didn't have a safety net, right? Just think of the suitcase that comes along with people that are coming into the doors, and making sure that the people who face that person who is already traumatized and in a high level of stress from their current situation of being houseless or homeless, understanding that person, meeting them where they're at, and like Melissa said, being a conduit for any service that they may need. Like Ms. Wanda said, being able to get that person to whatever services are appropriate based on their situation, and also understanding that you're not going to solve every single problem that person has just by you entering into their life. Like, that's impossible. And unfortunately, because poverty in the African American community is so prevalent and so generational, it is going to take generations to fix it, unfortunately. It's going to take a while to fix it because it took us a while to get to where we're at now. So you have to unpack everything piece by piece and start treating people not as a number and as individuals. That's all I can say.
I just want to say amen.
Amen. Thank you. And there's a question for all the panels, another question. Please share other concrete things you are seeing being done in your community to move towards more equitable practices in homeless services. Are local conversations happening? That is for the panelists, and it's in the chat, and it's just sharing concrete things you're seeing being done in your community to move towards equitable practices, and what local conversations are happening.
I can say here in Raleigh with Wake County Housing Justice Coalition, we are having conversations around with Raleigh Housing, well, not with Raleigh Housing Authority, with tenants who are who live in Raleigh Housing Authority properties around, and also we are addressing Raleigh Housing Authority and addressing the city about creating and building more housing for people who make 30% and below. You hear the term that they're building affordable housing, but what is affordable? So defining affordable in your community is one thing that must be done, I feel like, in any community, because what's affordable for you may be not affordable for someone else. Such as affordable for you, I tell people, may be a Tesla, but affordable for me may be a bus pass. So define affordable when you say affordable housing is being built. So we at a Wake County Housing Justice Coalition intentionally say we want housing for 30% and below. And so that addresses those essential workers that were so needed, that we relied on as heroes during COVID. Those working at Chick-fil-A and such, and those who drove the buses and such. So define affordable housing in your community. That's one conversation that needs to be held, so to ensure that you are not leaving them out when you are creating or building affordable housing. That I feel like that's one of the first things that needs to be done to start the conversation and to move forward. And also with developers, when you hear developers start having that conversation, we're going to come in your community and build affordable housing. Make sure that equity piece is included, that they're not leaving out those who have no income as well. And so that's 30% and below. So just want to say that.
Well, I want to say that in my community, the greatest thing I've seen that's pushing the needle is collaboration. I see a lot of people throughout the pandemic that have come together, different organizations that are in the community. CBOs are bonding together, and we're able to have the conversation with the elected officials. I also see on the flip side, the elected officials on the board that I sit on and in our county, we are coming together. We can do it better together. And so the conversation about affordable housing has definitely been one we've had in the air for a long time. We do have some units that are up. They just got finished building 60 units in Vance County. We also have, it was put on the table last night that we want to give a certain dollar amount to create housing opportunities, not just rental housing, but we want to be able to help people to help put down their down payments on a house. And so we're doing that. But the collaboration has been the biggest thing in the community that I live in. We're seeing people actually come together. The pandemic did a great thing for us to bring our resources together. So I think that's been a big thing. And I hate that I have to leave you guys, but I have to jump off. So thank you for this opportunity, Jeremy and Laurel. I'm so sorry, but you all have a wonderful, wonderful day.
Thank you.
Thank you so much. There's one question for the panel. What advice do you have for addressing the systematic racism that is seen throughout avenues we utilize to get people housed? Examples: ban list policies, regulation in public housing, etc. Thank you, Tricia, for that question.
Go ahead, Teresa.
I was trying to look for the question again so I could read it. Oh gosh, I lost the question.
I can read it again.
Thank you.
What advice do you have for addressing the systematic racism that is seen throughout avenues we utilize to get people housed? Examples were ban list policies and regulations in public housing.
I think if ever there was a time to address policy that disparages another population, this will be the time to do it. In the immediate, I would work with the agency to find a way to get around policy or create new policy, or directly create new policy to challenge the old ways of doing things. Like I said, racial equity is a conversation now, and disparities are a conversation now. And like Melissa said, there's collaborations happening because of COVID-19 that have never happened before. So I really think this is a time for us to engage with every level of money in our communities, from the top to the bottom, whether it's grassroots to our elected officials. We need to be having conversations about what homelessness looks like in our communities, painting that picture for them, giving them names. This is Becca, and Becca has this story. This is Tim, and this is his story. Tell these stories of people that are experiencing homelessness and make it real. Because I think a lot of times people, well, not a lot of times, but this has happened throughout history. They put homelessness is always on the table, but it always gets pushed to the back. But because of COVID-19, it's hit every economic level. People that are really wealthy have been affected by COVID-19. They've lost jobs, they've lost properties, they've lost income because of it. And I would say challenge it. Unfortunately, that's the only way we can do it at this point. We have to challenge existing policy and create new policy, and find your resources elsewhere. Find your resources elsewhere, because there are a lot of resources out there now that previously weren't available. And there's a lot of people that want to help. I mean, if GoFundMe and all these other websites, they've taught me that there's money out there for people. So if we can guide that money to the places where we need it to go, I really believe we can make things happen.
I would say that those who are empowered, that are sitting at any table that has decision making power for any type of funding, they need to look around. And if they don't have impacted people sitting at their table, something is wrong. Melissa has spoken about it, Teresa has spoken about it, and so have I. If they don't have Black people sitting at that table who have been impacted by homelessness, sitting there with this, not just sitting there, but with decision making power, something is wrong. They are not meeting people where they are. They're not being effective as they should be. That's one. The other thing, those of us who have been impacted, and they're not allowing us at their tables, we need to go create our own tables. And that's what we had to do with the Wake County Housing Justice Coalition. That's what we had to do with about 3 of the other orgs that I belong to when it comes to housing justice. It's also for us to have these conversations around racial equity, and the more we started speaking out, holding our own press conferences, creating our own blogs, started telling our own stories and putting them on social media and such, people started listening. And so that's what I feel, that people who are on both sides, people who are being impacted and people who have decision making power should do.
Thank you so much, panelists. At this time, if anyone has a question they want to put in the chat about racial disparities and racial equity practices in housing, you can put that in the chat right now. And one of the things I had wanted to ask the panelists, I'm in education, and we see disparities throughout education and our homelessness. And one of what barriers have you seen as it relates to racial equity and housing? And what are some strategies and collaborations you have used specifically to address these issues?
Are we talking in reference to like children and disparities in housing and things like that lately?
Yes, as it relates to with COVID-19, what I've noticed within the school system, we have had, when someone touched on the loss of, you had touched on the loss of caregivers, we have seen caregivers pass due to COVID-19, grandparents, aunties, and things like that. And that has left the child orphaned. And the biological parent may not be with them. So they're classified as homeless, but the predominantly it is affecting brown and black people. So how has that, what are some strategies that are used to assist with that, not just with housing, but with the disparities that the youth are facing, or the families, because it can also disrupt entire families when a caregiver has passed.
That is a tough question. I haven't experienced this in my work specifically when it comes to youth and school and housing insecurity. That I haven't faced that so much, but what I can speak to is that there's definitely a need for more resources within schools. I know there's McKinney-Vento and there's guidance counselors in schools that work with families and children that are housing insecure or doubled up somewhere and things like that. And that makes me think that there's definitely a need for a higher level of care and assistance regarding these family units because of these challenges that are new to face. Like I said before, my mom's a teacher, and just last week, like the entire 8th grade had to quarantine at home. And my mom said, well, what about the kids that have siblings that are in the 6th and 7th grade? Are they still coming to school? And of course they are. So COVID-19 is definitely shaking up the school system. Unfortunately, some families have been changed forever, but I think that calls for the Department of Education and the school districts to have these conversations in their communities with their legislators, with their homeless service systems, to find out what can be done and what's really needed for these people that are so drastically impacted. Because I mean, that's not just schoolwork and loss of a source of income, that's mental health that's been affected. If you've lost your caregiver as a child, and then you're expected to come to school and be productive, and it's hard enough dealing with children right now that were out of school for a whole year and we're asking them to focus in the classroom now. And yeah, I think that's a high question to ask, and a task force needs to be created.
I agree. I think part of what the task force need to also focus on are the cultural differences, such as Teresa mentioned that, if the 8th grader gets sick and then there are other kids in lower grades, what happens? Do they continue to go to school? Well, in when we were younger, if one of us get chicken pox, all of us are going to get chicken pox. And some people might say, what? Well, that's the way it was in our family, the African American, and it made sense to my grandma and all of them, because one parent was going to stay out of work and stay with all the sick kids at one time. And so it could be that, that eighth grader is sent away to a caregiver and the other kids have to go away too. And I don't feel like those younger kids should be counted absence. I think that's something that needs to be understood, that is a cultural thing, and that COVID-19 has opened up those opportunity to have those conversations. So I think that this is just another area for education and awareness for the school systems as a whole.
Thank you. We have a question from a guest. Have any of you worked with communities of faith to combat the misinformation and/or organize vaccine clinics to reach persons of color experiencing homelessness? If yes, please elaborate on the efforts and the outcomes.
Again, that's a cultural thing. Let me say, we work with the church on everything. Before COVID, after COVID, the church is a foundation in our culture. So yes, we work with the church to get that information out. It's sort of like Melissa was saying that the church was to go to the the pastor of these churches was the person to even over the pulpit to get some of this information out to make the church feel more secure about their decisions, whether to have the vaccine or not have the vaccine. So we had to rely on who the community trusted, and so that's how the church works in our community. On, like I said, not just on COVID, but on many things. So yes, we work with the church, and if there's a church in your community that has a reputation of caring for the community, not one who uses the community, but one who cares for the community, and has a great outreach program, that's a plus. That's a asset in your community. So.
I would agree with Wanda on that. I haven't worked with any faith-based organizations in regards to COVID-19, but actually before I started grad school, I worked on a data team where we implemented a health program in AME churches. And that was the purpose of it. They specifically went to the AME church leaders to help implement this faith-based activity program. And so they used the leaders to gain trust and respect within the community as a way to implement something positive. And I think that kind of applies to the COVID-19 vaccinations. Use the church as a conduit. Like it's been mentioned before, use the church as a conduit to communicating to the people in the community. If that's a place that they trust, definitely use it as such and communicate with the leaders so that they have the proper message and they're doing the work of working as a partner through you. So that's what I would say to that.
Check the chat, make sure there's no more questions. Awesome. Well, thank you, Teresa, Melissa, and well, Melissa's gone, but we want to thank and Wanda for your just astounding information that you have given us and elaborating on all the just all of the work you do. in our communities for working with those that are homeless, and especially the equitable issues that people that are brown and black in our communities are working with. So thank you so much for all the information that you have passed on. And right now I'm going to turn it back over to Jeremy Ratcliffe. Want to be respectful of everyone's time. I'll turn it back over to Jeremy if there's no more questions, so that we can prepare to close out. Thank you so much.
Thank you, Tambra. Once again, thank you all for being here. Thank you all for taking your time out today. Thank the panelists for giving us some incredible discussion today. And we would like to invite you to return to our next installment of this Racial Equity Dialogue series, in which we will be taking a closer look of some bigger systems, pieces contributing to racial disparities and homelessness, and just diving even deeper into this conversation. And so, with that being said, thank you all once again for your time. And the next dialogue will be on Tuesday, November 12th at 11:30 a.m. And the title of said dialogue is "Where Are We Going Now? How do laws and policies address racial disparities and homelessness?" So once again, thank you all. And I will turn off this recording. And this is me. This meeting is adjourned. Thank you. Y'all have a good day.
Thank you